How to help a cat give birth. Whether you are breeding purebred cats for a living or you are responsible for a cat that has become pregnant in your care, it is important to know what to do when the cat goes into labor and begins to give birth to her kittens. The typical gestation period for cats is around 65-67 days, so once you have confirmation that your cat is pregnant, it's important to begin preparing for the eventual birthing. Here is how to do so. Part 1. Preparing for labor. 1. Look for signs of pregnancy. There are several signs you can look for to help you discern if your cat is or might be pregnant. Common signs of pregnancy in cats are pink, enlarged nipples, a swollen belly, and an end to mating calls. 2. Take her for a checkup. Once you know your cat is pregnant, or if you suspect that she may be, take her to a licensed veterinarian for a medical checkup. The vet can verify that the pregnancy is advancing without complications and can advise you on how to prepare for the birth of the kittens. It's particularly important to take a cat who is overweight or has pre-existing health problems to see a vet as soon as you're aware of or suspect pregnancy, as she will be more at risk for complications. In some instances, the vet may determine that continuing the pregnancy could endanger the mother and that spaying her at this stage is the best and most humane way to proceed. The vet can also estimate how many kittens to expect, which will be useful later to determine when all of the kittens have been delivered and labor should be over. 3. Adjust her diet in the third trimester. When a pregnant cat reaches her third trimester, approximately 42 days into the pregnancy or when her belly is visibly swollen, she will have different nutritional needs, so be sure to make sure she's getting the proper amount of food and nutrients. Keep her on her usual diet for the first 2/3 of the pregnancy. For the final trimester, switch her to kitten food, which is higher in calories for a smaller volume of food. Because her womb will be pressing against her stomach, it will limit her ability to eat, so kitten food is ideal for keeping her nourished. 4. Set up a nest. Cats need a warm, calm, safe place to give birth, and your cat will deliberately seek out such a place prior to giving birth. Your cat will usually display nesting signs several days before the birth is imminent, and this is the perfect opportunity to direct her to the nest that you have already prepared for her. The laundry room or a bathroom are great places to set up a nest for her, just ensure that no kids or dogs are rushing through this spot at any time. The mother must feel safe and relaxed in her nesting area. She should have easy access to fresh water, a little bit of food, and the litter box, which should be about 2 feet away. Putting it too close can increase the chance of disease. Find a large cardboard box with high sides and fill it with old, soft things you won't mind getting soiled, like towels, fluffy blankets, newspapers, etc. Whatever material you decide on, it shouldn't have any strong scents, since the mother and kittens recognize each other by smell. 5. Prepare your cat for the birth. Continue feeding her high-quality food and watch for a noticeable reduction in appetite, which is usually a sign that labor is imminent. If you have a long-haired cat, you may wish to consider cutting the hair away from around the vulval region in advance, a few days or a week before birth. Some people also advise clipping long hair away from the nipples to assist the kittens in feeding. If you can't trim your cat ahead of time, however, don't do it at all, as it could interfere with the kittens recognizing the mother's natural smell after they're born. 6. Prepare yourself for the birth. In addition to having the nesting box, food, water, and litter box set up for your cat, you should also have materials ready for you to use in case of emergency. Keep a cat carrier nearby to use in case there are complications and she needs to be transported to the vet. Keep your cell phone charged and have the number to your vet and a pet hospital nearby or programmed into your phone in case she experiences complications during the birthing. Have a pile of clean dry towels ready in case they're needed for cleaning off the kittens. Buy cat milk powder appropriate for kittens and a kitten fostering bottle from your local pet supply store to have on hand in case there's a problem nursing the kittens. Look for KMR or kitten milk replacer. 7. Keep track of the pregnancy's duration. There is leeway in the length of pregnancy, particularly because it can sometimes be difficult to know the precise conception date, but a cat going over 67 days should be professionally checked. The vet may scan her tummy to check the kittens are healthy, and then suggest giving an extra 4 to 5 days. If the kittens have not appeared in the time, then a cesarean may be necessary. 8. Watch for warning signs of complications. Warning signs to watch for include abnormal discharge or illness. Abnormal discharge: a discharge from the cat's vulva is not normal during pregnancy. A green-yellow discharge can indicate a womb infection, a bright green discharge can hint at placental separation, and a bloody discharge or placental rupture. If you see any of these signs, contact your vet immediately. Illness: pregnancy places a stress on the body and can weaken the immune system. If the mother seems unwell, vomiting, diarrhea, coughing, sneezing, lack of appetite, then get her checked by the vet.